All right, holidays, a whole lot of fun, but next, we're talking holiday injuries. A local chiropractor joins us live with what he calls Santa spine and how to prevent it.
Listen, it's a busy time of year. You're hanging up the lights. You're hauling that tree into the house. You're carrying heavy shopping bags through the mall. The holidays can really take a big toll on your body. And this morning, we're very happy to have Dr. John Bruns. I get it right?
Correct, yes.
Bruns. I almost said Burns. It's so hard. Okay. Got that one, right? You're from the Joint Chiropractic here. This morning, you have some helpful advice for kind of how to navigate the season, especially if you do have that aching back right now. Thanks for being here. Dr. Bruns. All right, so what types of injuries are common this time of year? Because it sounds like they are.
So unfortunately, Santa spine is a very real thing. We tend to see in our clinics a huge uptick in generalized low back and neck pain during the holidays. People do a lot of stressful things during this time that they don't normally do throughout the year. A lot of travel, a lot of shopping, things that place extra stress on the spine that can cause injuries that we see a little bit more during this holiday season.
And I mean, you brought a spine with you here this morning. But so really, can you use this to kind of illustrate what goes wrong when you overexert?
What happens is when people tend to lift things improperly, they start to recruit muscles that are not designed to lift heavy weights, and that can cause a lot of strain and stress on the muscles attached to the spine, which then can move one of the vertebral segments out of position and actually lead to nerve pain. And nerve pain can actually go to different areas of the spine as well. So we can see an issue in the neck that can actually start to travel into the arm and down into the shoulder as well.
So what do? I mean, the tree has to get hauled into the house. You got to get the turkey out of the oven. You know, you got to grab the nephew and bring him back. So how do you prevent this?
We try to teach our patients proper lifting techniques where we like to see them stay very close to the core, to the abdominal region, and not to reach out very far, because any weight that you reach over a foot away from your body or to your side adds about 30 extra pounds of pressure that they don't have. So we recommend with Christmas trees to use two people. A lot of people try to do it on their own.
Get a friend.
We want somebody. We want them to get a friend. We want them to have a neighbor. Also with decorations, outside lights, we want them to use the proper ladder to make sure that their ladder has a good steady base, and also that they don't reach so far again off the spine, because that can cause a lot of muscle irritation and strain.
You hear people say, like, use your knees. You know, don't use your back. But that's my mother says that to me all the time. Use your knees. Use your knees.
Absolutely.
Is that legit?
Using your knees is completely legit. What it does is it allows the person to actually use their leg muscles as well for lifting, not just their lower back. Because when they don't use their knees properly, we tend to see, again, an overexertion in those lumbar muscles, and that leads to a lot of pain and stress.
Look at that. Dr. Bruns, good advice here with us this morning. Thanks for being up early with us on 5 Eyewitness News. Hopefully everybody gets through the holiday season without too many aches and pains.
Absolutely.
Brandy.